We got enough?
Well, no, but that doesn't
No.
mean you can't start the meeting without the
All right.
quorum. Until you have a vote, it really doesn't.
Right, you can discuss.
Yeah.
All right. I'll call the meeting to order in roll call.
Kathy McCoy, absent. Lorraine Bouget, absent. Mark Howard, absent. Gary Hilgendorf,
Present.
Mike Keith.
Here.
Jeff Johnson.
Here.
Katie, I know your name has changed.
I'm right here, Bellinger.
Katie Colby.
Bellinger now.
Bellinger. Bellinger. Okay, I gotta change this little sheet too. Doug Motek.
Here.
Bruce Paquette.
Here.
Jeff Schley.
I took his spot. I took Jeff's spot.
Does that make a quorum?
Since we added Elaine, I guess it would, then wouldn't it?
So what is it, 7 of 13 then?
7 of 13 then. Tweed is absent. John Yapple is absent. Elaine Smith. Here. Jason Weaver. Hopefully soon.
Keith,
All right.
What is your last name?
Keith, K-E-E-F-E.
Mike is our
So
interim
I'm-
director.
Yeah, I'm in place of Tom for a
Okay,
meeting.
Okay.
There'll be another person probably with your next meeting, but
all right.
All right. All right. So certification of compliance with open meetings law.
The meeting has been noticed to the public and news media as required by section 19.84 of Wisconsin statutes.
All right. And then the public comments here. Louise,
Hello,
did
can you
you?
hear me?
I do.
Okay.
I'll move up here so if I have mics so those that are on the line can hear me too. I'm Louise Ledenfin. I live at 7442 W State Highway 70 in the township of Ojibwa. And this is my first CJCC meeting since you organized. So I want to thank you all for your service. And I don't understand why there's so many people missing, but I'm guessing it has to do with the reorganization of the county board. No? Anyways, I'm sad that they're not here. So I'm here because I want to address you about the opioid settlement. The effect of opioid crisis in this community is longstanding and forever. I am the top generation of 4 generations that live here in this community, and we are all affected directly or indirectly by it, and it has caused great harm. Thankfully, no deaths, although it was very close because we've had overdoses. So here's the deal is this settlement money is going to come, and I don't want you to piecemeal it or nickel and dime it. I want it to make a difference. And that's a huge charge that you have. And then you have to get the county board to agree with it. But I'm thinking that there's 2 positive places that the money could go. Number 1, prevention. And here in our community, I think that means mental health services. And nothing but mental health services at all levels, from newborns to all the way up to seniors. However, you're the experts, you know how mental health services make a difference. So if I'm anxious, I'm gonna look for relief. I'm either gonna take a shot at something, or I'm gonna buy some street drugs, or somebody's gonna convince me that I'll feel better if I do this. And once I do that, I'm addicted. Understand? If I feel good, I'm not gonna seek out those kind of remedies. So we need to get to the feel-good part. And the best way to do that is to start young. So like, for instance, Governor Evers, whether you agree with him or not, whether a Democrat or Republican, he put healthcare professionals in every school system in Milwaukee County and Dane County, funded by the state. And that's great for those communities, but what about us? Where's our professional healthcare workers, mental health services in our school systems? CISA, maybe we can organize it that way. Or maybe we can just have healthcare professionals design a system by where they're afraid for a student, they run through a survey. If the survey shows 5 pluses out of 10, then they contact a professional, and the professional comes. Who knows how you do it? You're the professional. But that's what I want. I want prevention. Prevention at every level of age, in whatever institutions we have existing, and I want the good stuff. And then the other part of your money from the opioid settlement should be done in conjunction, spent in conjunction with all the counties around us. Hayward is the center of northwestern Wisconsin. If we can get all of those geopolitical borders to dissolve and pool the money together. Half for prevention, half for treatment. We need a treatment facility in northwestern Wisconsin, and we can't support it by ourselves. There's no way that Sawyer County could. Once it's established, up and running with professionals, and it can just not be a treatment center inpatient, but it could be outpatient also, and all the other good things that they're recommending around it. With satellites out here, but you gotta pool that money, and you gotta start early, because if they nickel and dime it in Ashland County and Russ County and Price County, and there isn't anything left, then where do we get the whole big fund? It doesn't have to be in Sawyer County, it just has to be in northwestern Wisconsin, because right now, you know where we have to go for inpatient treatment? Kentucky. Do you know how much that cost us? That's ridiculous. Ridiculous. So you have one chance and one chance only, because once it's established, then insurance companies will pay to keep it running. But you have to get it established, and that's where the opioid settlement money should go. That's all I have to say is those two things. 50% of your money that you're going to get should go to prevention locally. 50% should go to regional to get a treatment, AKA residential outpatient center in northwestern Wisconsin.
Thank you.
You're welcome.
There's a hand up.
We'll call Amanda. Oh, okay,
Jason Weaver is there.
yeah. Who had their hand up?
Just phone call.
Oh, okay. All
Hello,
right.
Linda Zomer calling in. The Zoom meeting ID is invalid, so any of the previous and the current agendas are not allowing people to get into the Zoom meeting. And I just also want to mention that while the handout does not mention alcohol abuse, both national and state reports have just come out, not just about the already increasing trends in alcohol abuse, but also it's been exacerbated through the pandemic. So in talking about any form of substance abuse, please consider them all. Thank you.
All right, so we need to approve the minutes from the previous meeting. Have a motion to do that? Okay, and a second?
Second.
Okay, all those in favor, say aye.
Aye.
Aye. Okay, okay, the opioid settlement update. And have you got that information, Lynn, or?
I have a packet attached that Tom sent me before he left.
That's what I have here, this.
It's the handout that's on the board.
Oh, okay, all right.
So I keep getting notices also, there's, somehow this is tied up in, I think, courts in Switzerland or something. They're still working on getting that straightened out. So the last notice I've got is the settlement and amount could be delayed a little bit, but they still think in the next few months, but probably not April. I think April or May was their original target, and they're not necessarily, now they're pushing it back a little bit. So that's what I know.
Okay.
Could we get a copy of this? Is it available online?
It was sent to you in your packet. It should be, this should be in your packet. If it's up there, it should be attached to the packet.
I didn't see it. I didn't get it.
We sure can if it's not.
Okay.
Are you opening it on the packet?
Yes, it came through online.
Huh. It came in on others. I'll send you a separate one.
All right, thank you.
All right, well, I know Kathy really wanted me to talk about us putting a group together, that basically what Louise was talking about here, that we need to get on top of that and get something going of a real action here in our county, because obviously we are seeing horrible addiction and overdoses and deaths from those situations. And we have obviously the Greater Hayward House of Hope, the New Reflections, and LCO has a number of facilities as well. And, but there's still people slipping through the cracks here. And so we need to, and her recommendation is that we should get a group of us, a smaller group, to try to get together and get our heads here and really work on this so we can come up with a concrete proposal that we can put to the county board about maybe a place right here in Hayward. Now, Louise's comment here on getting all the other counties involved, that's great. We're gonna have to really reach out in a hurry, because if this money does come in, I'm sure they're gonna be pouncing on the things that they need to do too. And I'm in contact with a number of people in Washburn County, and I think we would get cooperation with them. I know some people in Price County that are working on the same kind of deal. And I know we got Bayfield and Ashland County and Douglas County and all the, I'm trying to think of Rusk down in Ladysmith, and I think we could easily get them involved as well. So that'd be pretty much the surrounding counties
And
here.
the tribes too.
Yeah. No,
I
that's-
would, you know, if this group is agreeable to it, I wouldn't mind being on that little committee.
Okay,
Because I know I have talked to certain tribal council members about, you know, why not a treatment center? Because you can bill people's insurance, you know, you open up to everybody, you can bill people's insurance, and it can be self-sustaining eventually, but I don't know. I'm not a policymaker.
I can, if you'd like, every Monday morning, a lot of the administrators in the area and across the state have a Zoom meeting,
okay,
and I can kind of float it in that meeting to our, kind of our surrounding counties anyway, if there's, just see if there's any interest in pursuing such a thing.
that'd be good. Are you getting all this, Lynn? Okay.
Yeah, it's gonna depend on time.
So, yeah, okay, all right. And I know myself and Kathy both want to be a part of it, so that'd be 5 of us. Does anybody else want to be?
I can be a part of it for the voice for the Department of Corrections.
Okay, all right,
Because we would obviously utilize the treatment facility, and that's a high need
I
for
know,
our clients.
we actually had them call us about having a place like for the sex offenders to go on. There's
Oh,
no
yes, that's
place.
a need too.
Yes, so
There's so many needs out there.
there are. All right,
Can I ask a question?
sure,
But Mike, because it's not a formal committee, it's going to be called a work group, and there's no rules that it has to be voted on. Is that correct?
I think that's correct. As long as you don't have some kind of quorum of county board members on the work group, I think you're fine. I also wonder if you want Andy, the new county administrator, might want to be part of that too. I don't know. But
Sure.
I just
So
throw
could
that
I
out.
ask then that you leave your names on a sheet of paper as you volunteer before you leave? So that I can collect them.
well, once we get that group established, I think we would begin meeting like right away. To, I think maybe at this point, a weekly meeting, would that be too much or?
I think that would probably be necessary, at least at the onset.
Okay. All right, so we will get going on that. And anybody else want to be a part of that? And we will get moving, and thank you for being willing to do that, because that would be very good, because obviously you're going to have contact with all the other administrators. So. All right, well, that is good. And so, and then what we would do is we will obviously bring what we can do to this committee, and then it has to go to the board. We're just part of finding some solutions here to some of these problems that we are facing. And so,
So the little card going around is, if you're going to be interested on this committee, please put your name down there so that I can reorganize it into a list.
One on each side.
Oh, that card. Okay, we already started that one. but
Oh,
we'll do this one,
okay,
that's
whichever
okay.
card works, as long
We'll
as
do
we
it
all
again.
collect the names.
We were trying to be proactive.
all right. So let's go to the kiosk activity update.
Well, we've had one that had regular testing and I think one that was going to, and something else ended up happening out of that. And Becky, feel free to jump in here. The one that we had doing daily testing was set up for when primarily weekends, or if Justice Point staff wasn't here, if it was a holiday, working remotely, whatever the case was. It went okay. There was a few problems with the kiosk, erroring out. And coincidentally, both of them happened when I was not at the office, so I wasn't able to get a hold of our point of contact with Precision Kiosk. I guess without the judge here, I don't want to make a decision on whether or not we should keep it. At this point, I'm leaning towards it's probably not worth it, but I definitely want the judge's input on that. Becky, do you have any other thoughts?
No, I'm kind of on the same page with you. I mean, it went fine, because you and I stay in such close communication with, with him showing up to our office on a regular basis, and with him doing with you what he was supposed to be doing. But moving forward, if it's only going to be used as much as it was, I'm with you too. I don't want to make any decisions without the judge, but we certainly haven't been putting it to a lot of use.
Right. Any comments on that? All right, so we'll wait on a decision on that. Criminal Justice Coordinator Justice Point report. So is that you, Becky?
That's me. Can Heather introduce herself first? I think everybody knows her, but everybody knows her from probation.
Yeah, I'm Heather Lassard, new Justice Point case manager.
Okay, so as far as numbers go, right now we have 57 active cases on pretrial. We have 19 on diversion. We have 149 pretrial wait list. Heather has been working diligently on our wait list. Thank you very much, Heather. So far, she's contacted 30 people on our wait list. She's done 7 intakes. She's still working on that every day, making progress. And we have started taking people on referral back on pretrial and on diversion. So we're back up and running, taking people, fully staffed.
All right, that is good news that you're up and running and full steam ahead. We need all that, that's for sure.
I have a question. I just wanted to ask you, now that you started having that office in the tribal court, in the tribal building, how has it been going? Have tribal members been able to meet with people? And
Yeah, we just started. I had a couple people show up last week, but I don't have much of a caseload yet, so I'm working on a lot of the wait list. But I did meet with a few people out there at least.
I know somebody's in there today as well. So do you come every Tuesday or Wednesday or?
For sure, pretty much every Tuesday. Well, Wednesday and Thursday would be a full day between Katie and me.
Okay.
And then we'll go out half a day on Thursday, and then if Becky's available, we'll go out on Fridays.
Oh.
And we also have it staffed on Tuesday, not with a case manager, but we do have one of our other staff members there on Tuesdays for at least half a day.
What is her name? She's
Rihanna.
here. Rihanna.
Brianna.
Rihanna.
Yeah.
Okay.
Okay. Community services update, I guess that's me. We are full at the men's house, and I think the ladies' house has one opening. And how about LCO? Is there anyone from LCO? I mean,
I wouldn't know at all,
okay.
but I can talk a little bit about our Healing to Wellness Court, just to let you know that our case manager, Rose Barber, she took a lateral transfer back to Oakwood Haven. And so we're kind of without a case manager now. And we're trying to see if the grant coordinator, Susan Awesome, will kind of do both jobs for the continuation of the grant, or we have to seek out somebody else. But so we do have some referrals pending. So we need to do something about that as soon as possible. But I don't know anything about the other
The
services there.
enrollment, okay. I know there's a lot more beds available out there now than what there's been in the past. So
Oh,
with, at least I know with the men. So it's a good thing. So. All right, so. Anything else? Doesn't look like anything else on here. Future agenda items.
I would just ask that we add the kiosk back to the next meeting agenda. Assuming the judge will be here, we can discuss it further at that point.
All right. Anybody else?
as far as the work committee then, or should we all just wait until we get an email from somebody? Okay.
I will get with Kathy and with the names from Lynn. And we will try to set up a time and let everybody know. And we will get running.
Gary, will you add me to that work committee, please?
I already did, Becky.
Oh, okay. Thank you.
All right, well,
Can I ask
sounds
you a question?
sure.
Does this committee, the CJCZ, have you reached out to the school systems for a member? It just seemed to me it would be really beneficial to have someone from a school, especially a school district as big as Hayward on this committee. I don't know what professional at the school isn't tied up and not that busy that they could spare the time, but it would be a great place for input back and forth for prevention. I would advise that if you have a reorganizational period at all, I don't know if you do, the county board does, that you should reach out to the school systems, at least one of them. There are two in our community that are public. That would be the Winter School System and the Hayward School System, or maybe they have an they used to have CISA years ago. Do they still have CISA? So maybe the CISA representative to those schools could be at least, if not a voting member, at least on your email list so they know what's going on with the CJCC. Just a suggestion, that's all I got.
Thank you.
Do you have a meeting date?
That's what I was going to. So hard to believe, Wednesdays work good for everybody. Yeah, it works good for me. So let's see, do we want Wednesday the 4th? Would that work? Or the 11th? Would that be better?
The 4th is out for me, the 11th should be fine.
11th, okay.
Let's check the county calendar.
May 4th is okay.
I will be gone on the 4th.
Write that next, the 4th out for 2. How about the 11th? Everybody okay on the 11th?
I should be able to make it.
Okay. Okay. All right, well then let's make it Wednesday, May 11th at noon, right here in the assembly room. All right. That's a record.
You done good.
I'll tell Kathy.
Accomplished a lot.
What was our public safety record, like 19 minutes or something?
All right, well, do we have a motion to adjourn?
So moved.
So moved. Second, okay.
Thank you.
Okay, all in favor, say aye, and we're out of here, huh? All right, well, hey, I thought we'll make some good progress here with this work group. That will be a big project. So thank you for everybody wanting to be involved and just everybody making time to be here for the meeting today.
Thank you.
Yeah.
Now,
Thanks, Gary.
those are weekly meetings. When CJCC had its last work group, Tom assigned me to each of those meetings for minutes. So if you're having weekly meetings and I have to be there, we have to check.
Coordinate with you, okay?
Monday,
Unless someone else wants to take minutes.
Monday or Friday is always best for me
Mondays?
when you're considering meetings.
Yeah.
Because our docket's pretty full. But I think this is important. And, I often ask myself and friends, what can we do, besides what we're already doing? And I don't know what the answer is, but maybe we can figure something out.
Katie, would Monday work for you too? Okay, Jeff?
Mondays are fine, preferably late morning or afternoon. Next week is out on any day, and just we have a management conference in town. And,
Oh, that's right,
scheduled. Yeah, you'll be there.
Yeah.
What kind of conference do you have?
The law enforcement management conference.
Oh, okay.
Used to be up at Superior.
Michael,
and Black Creek
that
State
for you
this
too,
year,
Monday?
so.
Actually, Andy will be here
Oh, okay.
going forward, but I do know Mondays noon would be the earliest he could do it because there's lots of webinars on Monday mornings that he'll be part of.
I guess I would be meeting like 1 o'clock, would 1 o'clock on a Monday work?
Noon would be better.
Noon would be
Me,
better?
Yeah. I mean, I would be willing to give up my lunch.
Okay, so noon on Mondays. All right, let's shoot for that. I will get a hold of Kathy here right away. And I'll get with you here then too.
And if I can't make it, someone else can certainly take me.
We need you. I'm no good at
It all
that.
depends on the other meeting schedules.
All right.